There we go. Okay. Hey, good morning. This is Dawn Thompson with my co-host Nicole Harlow, and we are excited to have Charles Johnson on the show today. Charles, thanks so much. First of all, our goal is always to have really relaxed conversations. I'd love for you to just kind of briefly tell us how you got here, because you've learned quite a bit from a story you never anticipated being a part of.
No, absolutely. So first and foremost, thank you, Dawn, Nicole. It's a pleasure to be here with you both. Dawn, you know that you are one of my sheroes. Thank you for the work that you have been doing for decades, long before I knew that a lot of the stuff that we're going to discuss today is a problem. So it really is an honor to be here with you. And thank you just for your support of myself and my family throughout this fight. With that being said, I fancy myself a dad, an advocate, a dadvocate. And this work is, interestingly enough, Dawn, something that you know, it's not work that I chose, it's rather work that chose me. I was fortunate enough to meet a woman that absolutely changed my life. And my wife, Kira, was truly sunshine personified. And, you know, we're talking about a woman that spoke 5 languages and flew planes and traveled the world and ran marathons. And I always wanted to be a dad. Right. Always want to be a dad. And, you know, throughout this interview, the more that your audience will hear from you, realize I'm really, truly a big kid myself. And so we found out we were welcoming our first son in 2014, and I was over the moon. And we talked about how cool it would be to have back-to-back boys, right? These kind of built-in best friends that would just grow up, just challenging each other. And when we found out we were welcoming our second son, Langston, and that our boys would be 18 months apart, we were just so tremendously thrilled. And so on April 12th of 2016, we walked into Cedars-Sinai Medical Center in Los Angeles, what we expected to be the happiest day of our lives, Dawn. And I know you've heard me share this story, but we walked right into a nightmare. It's important to understand that Kira was not just in good health, she was in exceptional health. We're talking about every single one of her prenatal visits. She, you know, flying colors, all signs pointed to both her and our new baby being exceptionally healthy. And so we went in that afternoon, but we expected to be a routine cesarean at our doctor's recommendation around 2 o'clock. And so we show up, Langston comes, he's delivered perfectly healthy, 10 fingers, 10 toes. And they take us back to recovery. And I'm sitting there on top of the world, just thrilled, like everything that we had hoped for, everything that we had prepared for, everything that we had prayed for was finally here. And as I was sitting there in the recovery, which is typical, I know this is a very informed, elevated audience, but it's typical for those of y'all who may not be familiar with the cesarean delivery. It's typical. They've got Kira back in recovery. She's resting. Langston is resting. As I'm there, just soaking in all this joy of being a father for the second time, that's when things took a turn for the worse. And I actually noticed that there was blood in Kira's catheter. That was around 4 p.m. I brought it to the attention of the doctors and the nurses at Cedars. And what took place over the next 10 hours is something that almost 8.5 years later, I still struggle to comprehend. Kira was allowed to bleed and suffer needlessly for more than 10 hours while myself and my family begged and pleaded for them to take action. Hour after hour, we expressed our concerns. We advocated for her. There were clear signs very early on that Kira was hemorrhaging significantly internally, but our cries for help fell on deaf ears. Keep in mind, she went in for the delivery at 2 o'clock in the afternoon. It wasn't until after midnight the next morning that they finally made the decision to take Kira back to surgery. And when they took her back to surgery and they opened her up, there were 2 liters of blood in her, 2.5 liters of blood in her abdomen, for where she was allowed to bleed and suffer needlessly for more than 10 hours. And when they opened her up, she coded immediately. Her heart stopped, and they worked on her for some time, but they were unable to save her. And I'm always transparent about the fact that when I walked into that hospital that afternoon, Dawn, you've heard me tell this story lots of times, but when I walked in that hospital that afternoon, the thought that my wife would not walk out to raise her boys, it never crossed my mind. Right? I thought I did everything right. I never missed a prenatal appointment. talking to a woman that never skipped a prenatal vitamin. We thought that we had done our research, our homework, but it wasn't enough to ensure that my wife walked out to lead the life that she deserved. And I'm always transparent about the fact that when this first happened, I truly thought that what happened to Kira, I thought it was a freak occurrence. I thought that she was an anomaly. And I thought that women like her and families like us that do everything right, that this just doesn't happen in the United States, in our country, with all the modern healthcare advantages and that we have at our disposal. But what began to happen was that other families began to share their stories. And I was hearing these other incidents of obstetric violence, right? Obstetric violence and horrific birthing experiences and instances of clear-cut discrimination, and then other mothers that had made that ultimate sacrifice just trying to give the gift of life. And at first, I really honestly, I thought that this is just people's way of trying to support me in my grief, and that's why I'm hearing all these stories. But as I'm learning more and more, I'm thinking something just isn't right. And that's when I began to do the research for myself, and I came to understand what you and your audience know oh too well. And that is the fact that we are in the midst of a maternal mortality crisis right here in our country, and that Kira was not an anomaly. That she was, in fact, part of an epidemic in our country that is plaguing families, regardless of their zip code, regardless of their socioeconomic status. But it is disproportionately affecting Black women and women of color. And so I didn't know what to do. I didn't know how I could make a difference, but I felt like I owed it to Kira. I felt like I owed it to my boys to do something. And so I began to share Kira's story publicly the Friday after Mother's Day in 2017, which is just a little bit over a year after she passed. And not knowing what to expect, naively thinking that I would share her story and go back to being a soccer dad in obscurity. But the universe and Kira had very different plans for my life. And Kira's story, along with the story of a lot of other women, have become the catalyst for what I call the maternal health revolution.
Yeah.
And an awakening in our country of how we are failing mothers and coming up short. And so I founded an organization called For Kira for Moms. And for the past 8 years, we have worked relentlessly to not just improve maternal health in our country, but to eliminate the maternal health crisis in our country, period, full stop. It is my core belief that every mother and every family in this country, every birthing person, regardless of how you show up, deserves a safe, dignified birthing experience. And there should be a fundamental human right for a mother to give birth to a healthy child and then live to raise that child. So this is the work that I'm proud to do in Kira's honor. And I'm proud of what we've accomplished, but we certainly have a long way to go. And I'm really proud to be here standing in solidarity with you and your audience today to talk about how we're going to make that happen.
Thank you for sharing all that. I can't even imagine what it is like to relive that over and over and over again. And like understanding that it's critically important, right? I mean, it's so often we don't have people who share their stories in this way, the way that you have. And obviously you have a skill set, Charles, not to mention, like just being an incredible speaker, know how to move people. And I think that has been a gift to us as a birth community, right? Because as there's some things about this that, I'll be honest, is frustrating for me, because it's like when in the work that I do, my whole thing has been about the overuse of interventions, too many C-sections, all of those, which is even far more challenging or like, I don't know, worse is not the right word, but it's
sinister. Right? Sinister. Okay. And there are, and this is a real conversation, right? I wouldn't show have no conversation. It's sinister. We are dealing with a system that is full of, putting profits over patients,
Yep.
perverse incentives for healthcare providers,
Yes.
deprioritization, dehumanization of families across the board, and it's at healthcare at large. And what we're seeing is that the maternal health space is just the canary in the coal mine for
That's
what's
right.
going on across the
Yeah.
board.
It's just a symptom. It's just one of the symptoms. And like the thing that I talk about all the time is about how, this work that you've been doing, Charles, has led to this amazing thing because, hemorrhage is one of the number one causes for maternal mortality, right? So the answer to that question, or the answer to that, has been the system has said, okay, we need to put these trauma carts outside of these rooms every time we're doing a birth or whatever. And I'm just like, but why aren't we having the discussion about why women are hemorrhaging? Why they're hemorrhaging? Like, let's have that discussion. And it's because that likely that woman was induced prematurely for 3 days and ended in a cesarean, and her uterus has been so overstimulated that now it won't stop bleeding. Like, why aren't we looking at that? And instead, we deliver this arrive trial that says now that all women should be, or well, it doesn't say exactly that, but like women should be induced at 39 weeks to reduce the C-section rate. That's fucking absurd. Excuse my language. It's absurd. And yet we just keep doing it because, normal physiological birth is not a good business model.
Well, like you said, Charles, profits over patients. I think that is so important for our listeners to understand, because I think as first time moms, second time moms who haven't been introduced to all of the things that could go wrong, we're blind to the fact that our doctors don't necessarily have our best interest at heart. Not to say that they don't, but they have other avenues of motivation and education that are subconsciously even programming them to think about other things over this woman and this baby in front of us. And what we need to be doing, and I think myself, Dawn, Charles, many of us in the birthing community are trying to just show women that they have the power to be educated, to be informed, to speak up, to demand a level of care, and not take anything else to settle.
Charles, I have a question.
Mm-hmm.
And I think I've asked you this before, but I don't recall the answer. When you guys had your first baby, was it an induction that ended in C-section?
No. What happened? Okay. That's a great question. So when we had Charles, we were actually trying to do it the old-fashioned way with the vaginal delivery. And then every time she was having contractions, his heart rate was dropping. And then so ultimately they did a emergency C-section as a preventative measure, but he was born perfectly healthy, no complications. So when we got to our second birthing experience, the decision to proceed with a scheduled cesarean was suggested by our provider. Nowhere was there a discussion or option of a VBAC.
Because she would have been a great candidate for a VBAC.
So many of these things that we didn't know, but I just really, if you don't mind, I want to just go back a little bit and just talk about something that Nicole said, because I'm like, you know what? I'm already saying we're going to have to schedule a part 2, y'all. Like, listen, y'all about to get me rolling. But let me say this. Both of you all make such poignant points, and I'm sitting here, my foot is tapping on the table, I have goosebumps, because these are the conversations that we have to have. And let's have a frank conversation about the medical industrial complex. And we talk about these interventions. The reality of the situation is every single one of those interventions becomes a line item on your bill.
Yes, that's right.
So the objective is how heavy can we load your birthing experience with interventions and cost, and how quickly can we get you out and turn over that bed for somebody else? That's the harsh reality of the system.
Of a business. It's a business model.
And then when we look at that and the systematic dismantling of midwifery, doula care, all these things play into a profit model. I have so many instances that I could tell you all about perverse incentives and the things that I have learned about the way business is done. And it carries over, and don't even get me started on the way babies and children are cared for in the NICU. It will make your blood boil. I literally had a conversation with a company that wanted me to come on their advisory board. They have an amazing tech stack that will do a lot of things, reduce maternal morbidity, mortality, reduce the number of days in a NICU. And we were having this kind of planning meeting about a go-to-market strategy. And to me, I'm like, this is easy. Like, you're going to do this and this is the cost, and it just makes sense. And I was thinking to myself, I've accumulated this network of hospitals and hospital CFOs, and they'll love this. And I said, well, I can call X, Y, and Z, and and everybody got quiet in the meeting. And I recommended, a go-to-market strategy, which would entail talking to hospital CFOs and the administration. Everybody got quiet, and they looked around the table as if to say, who's going to tell him? And then finally, somebody said, we can't take that approach because hospital CFOs count on each year a certain number of these babies being $1 million babies. And they are not incentivized, nor do they have any desire to reduce the number of days that these babies stay in the NICU. And that broke my heart.
Yeah.
But that is just emblematic of the type of perverse incentives and things that are going on in healthcare. But I want to go back to the other point that Nicole made, is that is why it is so critically important to empower families with the information they need to make empowered decisions and choices about what options are available to them, how we select providers, how we advocate, how we hold these providers and systems accountable, right? And so that's why these conversations, these discussions are so rich and so important.
Well, and that's exactly why I started Birthify. You are speaking to exactly why I created it, because I just, after 22 years in this industry, I have seen person after person getting railroaded into this outcome that they didn't want, didn't need, all these things. And I felt like the thing that I knew, I feel so confident in, is that if people had more information, were making fully informed decisions about their care options, they would frequently make different decisions. Absolutely. If they understood the risks, the benefits, the alternatives, all these things. And like, I think about, for instance, such a common one is going over 41 weeks, right? And the provider says, there is a risk of your risk of stillbirth doubles after 41 weeks. So, I mean, who is going to do that? Who's going to risk their baby like that? Nobody, right? I mean, like, most people are going to be like, oh my gosh, well, I'm definitely going to do an induction then. But that's the kind of information that's deceptive, because when you say to them, okay, so what are the actual statistics? And it's, 0.5% per 1,000. I got to be clear in my statistics. Per 1,000, 0.5% per 1,000. And that number doubles to 1.6%, I think. So like, you're like, yeah, it doubles, but it's still, significantly lower than your risk of having an induction and ending in a C-section.
I think a huge problem that we face, and I'm talking about personal experience and then, stories that I've heard from others, is that we talk about profits of the hospitals and, the line items on the bills. But unfortunately, hospital birth for many, not for all, is almost cheaper for the family, because our insurance companies are right in the system with us, right? Like, I personally had a hospital birth, a birth center birth, that were both covered by my insurance, and I paid almost nothing, even though those bills were $19,000, $20,000. And then I proceeded to have 2 home births that on a scale were $6,500.
Yeah.
But that $6,500 was out of my pocket.
Yeah.
because insurance companies won't cover home births, or you have to fight tooth and nail. Luckily, I got a reimbursement for about half of that for my first, because she broke it down like prenatal care, postpartum care. It wasn't just the birth. So we were able to get that. But the fight that I had to do to get that money back too, they don't make it easy on families.
In the midst of trying to do all the things with
Right.
welcoming in the midst of postpartum, all that comes with that, right?
Right. 100%. And if it wasn't for me being, Charles, I know you don't know my story in the background, but I had really bad postpartum anxiety and OCD with my first, which is what propelled me into this work.
Yeah.
So birth number 2 was to make sure that my postpartum experience was better. And then I went down all the rabbit holes, and my best friends are doulas and therapists and all the things now, because I saw all the moms suffering from postpartum. My second pregnancy, it was like these providers, I switched, I think 3 or 4 times, because they were like, oh, you're too heavy for this. Oh, you may have, hypertension. Here's some medication. I just saw the writing on the walls. They were trying to get me to a C-section. And that threw me into, like I said, various rabbit holes. But I think whenever I talk to someone about, oh my gosh, you had a home birth, how did you do that? The financing is always what comes up. I couldn't afford that. I can't afford a couple $1,000s, when in reality, home birth is a fraction of what hospital birth costs. It's just that someone else is paying for it, but someone else is profiting off of that as well.
Absolutely.
So
Charles, can I ask you, you've learned an awful lot that you never anticipated learning.
Yeah.
What do you think? Just imagine that the person who's listening to us, because the thing I always worried about going and having these conversations so frankly, and is that I worry that it scares people.
Sure.
Right? It scares people, and people have a lot of anxiety going into their birth and all of that stuff. But what do you what's the number one thing that you think people should know right now?
Absolutely. So here's the thing. Is that you can and you deserve a safe, dignified birthing experience. The unicorn birth, the wonderful, beautiful birthing experience of your dreams is possible. With that being said, it's critically important to do the research and be informed about all the options, all the risks, as you said, available, so that you can make the decision that is best for you, your situation, and your family. So for me, one of the things that we all understand is that in birth, there is a lot of tribalism. There's a lot of tribalism. And so as an advocate for all birthing people, my belief is this, is that if you want to give birth in your living room, surrounded by family members and candles in a tub, that should be your choice, right? If you want to do a birthing center birth, like Nicole did for one of her births, that is your choice. If you want to be in the hospital, hooked up to every modern day painkiller and pushing the button every time, that is your choice.
Yeah.
You should have access to that. And drum roll, it should be paid for.
Yes.
Right? It should be paid for. With that being said, it is critically important that you are able to research and understand all those, and even look into what we call integrated models of care, right? Where that OB works with a midwife or a doula. And then you can, there are situations in birthing experience that exist that it does not necessarily have to be an either or, it can be a both and. It's about seeking about understanding providers that can give you that birthing experience. So the research, the evaluation, and making informed decisions is critical. But a big part of this, and a big part of my work, make sure that we can remove some of the systemic and financial barriers associated with making that prohibitive, right? I don't want a family to have to make that decision and really desire a certain birthing experience, but say that, look, this is out of reach because we just can't make the financial or the geographical or the practical we can't make these things work, right? So I have to go with a birth that I don't feel as comfortable with because of that, right? So there's a heavy lift on that to make sure that one, quality care is accessible and it's affordable. And so that's a large part of the work. But that would be, I know I said a lot, but first and foremost, it boils down to researching, understanding what you feel is the best birthing experience for you, and understanding that a safe, dignified birth is possible. We just have to do all the work on the front end to make sure that we are informed and prepared, and we seek out providers that are aligned with our desires.
Well, and I went, Nicole, I went very similar to you. And like when you're saying that, Charles, I think it's also possible to have an evolution, because I've met many women who at the beginning of their pregnancy are like, I'm getting all the drugs. Like, just plug it in now. Actually, I'm good. Just go ahead and put that epidural in now. I'll wear it for my whole entire pregnancy. Like they're that. And then they come, full circle, right? Once they start to get educated and informed and start to learn about the risks and benefits of things and all of that. But also, like I was someone who, when I had my first kid, I was that person. Like, I don't want to know anything. I'm going to read a book or two, and like, I'm just going to have a baby, right? Because people have been doing this for millennia. Right. It happens. I ended in a C-section because I was not actually in labor, really. I was in very, very early labor. And instead of them sending me home, they checked me in. And, but I also, even when I became a doula, I did not understand why anyone would want to have a birth without an epidural. I thought that was ridiculous. And so, I mean, talk about full circle. I had my last kid at home, VBAC after 3 C-sections, because the more and I mean, Ina May's Guide to Childbirth, her book changed my life, because the first thing I understood was this person was explaining how my body works. Right? Like, I didn't even know that going in. I didn't know how the uterus worked or the cervix worked. I knew nothing.
So I know we typically compare births to weddings when we talk about the financial aspect, right? Like, we invest so much in weddings, but then birth comes and, I can't afford a doula. I can't afford to do this, right? However, I want to spin that a little bit with just the planning and the education. Like, think about how much people plan for a wedding. The invitations, the details, the people, the seating charts, the environment that they set up, what people, who are allowed to come, who's not allowed to come, right? Like, if we put half that effort into our birth, could you imagine the possibilities and the improved statistics and all of the things where, like, we have 9 months, like we find out we're pregnant and we have nothing but time. Whereas like a wedding, you choose how much time you have or not. So you could essentially do it in 6 months and have to rush through all these decisions. But
I think they do that research though on cribs and strollers and like shit you don't even really need. Excuse my language.
Well, because it's consumerism, right?
That's in this episode already.
That's what we're guided to. The baby shower, I had mama blessings for my latter 3, and everyone's like, what, you're not having a baby shower? I'm like, no, I'm celebrating myself. I don't want gifts. I just want, like, if you want to give me something, help me pay for my doulas, help me pay for, my pelvic floor therapy to help my body heal. Like, and it was
fascinating.
So much resistance from my family, whose old school generations is, let me just buy you the crib, and it's a whole mindset shift. Our society views so much skewed because of consumerism, right? Like, it's all about money if we get down to it.
Social norms, right?
Yeah. And it's hard to be that black sheep. Like, I've been the black sheep my whole life. So for me, it kind of was a fitting role. But there's a lot of people out there that are afraid to go against that, especially with your family,
Absolutely. I think that's one of the things you speak to something that's very important, right? Is that there are, going back to these, these hospitals, like we all of us are products of our environment and our experiences. And we gravitate towards things that are familiar, right? Whether it's a provider, whether it's a hospital. My girlfriend had her baby here. I was born here, this, that, and the third. And one of the things I actually heard a hospital CEO talk about is how, labor and delivery is a loss leader for them. But their hope is that if enough people have babies here, then this is where they'll come for their knee replacement, or when they have gallbladder surgery, or these things. It is almost a marketing strategy.
Yeah.
And so these are all things that there is a lot of work to do, Nicole, as you said, to shift consciousness and awareness towards those things, and reprioritize some of the things, not only from a time investment standpoint, but from a financial investment standpoint as well. Because for me too, and I'll be candid, that this was something for us as we thought. We did research. There's no expense that I would have spared. But I thought that I sought out the best hospital, right? I thought that I had the best care, and I was so woefully unaware of just how much I did not know. I am a completely different human being when it comes to the level of knowledge and awareness that I have now. And I always am adamant about the fact that everybody is not going to, there's no impossible that the average father could absorb the amount of things that I have absorbed over this 8 years. With that being said, if I can distill these things to certain things that all families, all loved ones need to know, and then help them prioritize those things, help them think about certain things, then that's certainly a certain level of success for us.
So, Charles, why don't you talk about some of the projects that you have going on? Because I know you are always going in 17 different directions, but as it relates to this work, because I feel like you're just doing so much.
Sure.
And even let's talk about your legislative work. I mean, you're in DC every time I feel like you turn around, you're over there marching the hallways.
Yeah. So right now we have, as an organization, I don't want to date this episode too much, but over the next 10 days, we're activating about 7 different events. And we have been, now every week isn't like this week, but this just happens to be a week that's about to be a hell of a year. And I'm very proud, and I'll say this proudly, is that as an organization, we do more in a week than most organizations do in a year. And so, big picture, this organization, we approach this work in 3 distinct buckets. It's educate, advocate, and legislate. So from an education standpoint, it is empowering families with the tools and resources they need to not only survive, but to thrive before, during, and after the birthing process. It is about educating and empowering providers with tools, resources to help them approach their practice with the ability to center compassion and empathy, while at the same time addressing those isms. And so I do a lot of work and a lot of consulting around implicit bias training. But what we do that's a little bit different with our work is, instead of, and there's a lot of people doing great work in the space, don't get me wrong, but what's different is we center the lived experience. Instead of coming in with theoreticals and going through PowerPoints and singing Kumbaya, I'm not here to tell you what I think. I'm going to tell you what I know. I'm going to tell you what's going to happen if you don't actively address your bias and your isms, and how it's going to have catastrophic and sometimes fatal consequences. And then we address it from an institutional standpoint too, is that it's not enough to just take your providers and the people who are in touch. It's about institutional mind shift, and institutional. And so that's education. Advocacy is making sure that we support families that have been impacted by the maternal health crisis. So we have something that is called the Maternal Mortality Response Team. And so the way that this works, Dawn, is that anywhere in the country, if there's a family that has been impacted by maternal loss, we mobilize resources to support that family within 48 to 72 hours.
Yeah.
Each family's needs are different. But we have partners that have come to the table to supply formula, diapers, wipes, all the practical things you can think of. It's covered for at least a year. Legal support, mental health services, sometimes childcare, all these things that we try and step in and support. And then lastly, legislation is a doozy. And I'll be honest, I hate politics. I'll say it, I'll tell it to whoever's face.
Amen.
That being said, But the big but is that I understand that is a necessary, important piece of moving our country to higher ground. And so we've been very fortunate. We first really, with your help and the help of a lot of amazing people, were able to work in a bipartisan fashion to pass the first ever piece of federal legislation to prevent moms from dying in childbirth in 2017 called the Preventing Maternal Deaths Act. I had the opportunity to testify before Congress, make a bunch of trips to DC, and get that bill passed. And that was an important step, but it was just a first step. It was the first time that our country had recognized and invested in efforts to improve the maternal health crisis. And so we went back right before the pandemic for the first time, with a comprehensive set of bills, not one, not two, not four, not 10, but 13 bills that comprise what's called the Momnibus Act, the Black Maternal Health Momnibus. And it addresses, I don't want to say but almost all of the varying aspects of the maternal health crisis, the Black maternal health crisis. And I say the Black maternal health crisis because the Black maternal health crisis is the American maternal health crisis. And people may ask, why do we need legislation just for Black women? Because when we fix it for Black women, we fix it for all women. And so this will address social determinants to health, the impact of climate change on moms. There's so many vast, the special needs of incarcerated moms, military moms, and the list goes on. And within that package of bills is the Kira Johnson Act, named for my late wife. And so we're really proud that that's going through Congress now. One that we may have talked about, but our latest piece of legislation is the Dads Matter Act, which is a bipartisan piece of legislation specifically aimed to empower fathers to be more informed, more empowered in support of mothers and birthing. And so while midwifery is amazing, legislation is amazing, policy change is amazing, implicit bias training is amazing. For me, the part of this trinity that is left out of these conversations is the father or the non-birthing parent. And so I believe that if we can empower and inform fathers and non-birthing parents to do better, show up, advocate, be more supportive, because we're going to be the ones that recognize symptoms first, postpartum depression, preeclampsia, all these things, and understand what to do, how to pivot, how to support, that this will go a long way in drastically improving outcomes. And then on the state level, we've worked tirelessly to help expand postpartum Medicaid coverage to a year postpartum. In 2021, I think we had about 6 states, and now we're up to about 47 states that expanded care for moms up to a year. So next week, I'm literally going to DC tomorrow at about 4 different events for the Congressional Black Caucus. Then we're going to go back the following Tuesday. So I'll be there all week this week or until Friday. Next week, we're going to go back and we're going to do something, the first of its kind, Capitol Hill Advocacy Day, specifically with fathers. And it's going to be all dads with varying lived experiences, varying levels of expertise. We have some dads like myself that have lost moms. We have some dads that are doulas. We have people that have been former heads of ACOG. We have some mental health specialists, some people that are doing private sector work, all coming and saying, hey, look, we're here. The dads are here. And we are here to make sure that men and fathers understand their very important role and what responsible allyship looks like.
So I absolutely love that, Charles. Thank you so much for the work that you're doing in that realm. And I want to go a step further because, again, a lot of moms, women come to me and say, oh, I would love to have a home birth, but my partner doesn't feel like it's safe.
Yeah, that's
husband,
so or just my partner doesn't want me to have a doula. Like we hear that.
A doula. Like I don't want to say that the partner is sometimes the hurdle or the challenge, but I hear it a lot because I love my husband, but like baby wasn't coming out of him, so he had no say. You know what I mean? Yeah. He supported me in every way. I love him so much. And how he's let me kind of lead the way because that's just our relationship. But I know there's many relationships out there that's like, oh, my husband doesn't feel comfortable with X, Y, D, Y, Z, or he doesn't understand. So how can you, for the moms listening, how would you as the father say, like, how do we approach it? How do they get it through their head a little bit in a nice way?
So let me start this piece of the conversation by being extremely introspective. And even though this is painful, a lot of people don't have the courage to ask me this question. So I'll ask it and I'll share it. If there was one thing that I could do differently for my wife, it would be engage a doula. Period. Right? I believe that doulas matter, midwives matter, right? That's first. With that being said, I would challenge you all as a couple to understand the benefits and pros of having a doula or a midwife, and
For both of you. For both of you. It's not just for her.
Both of us.
Right.
And I think that research is key. I think also another thing that's important too is that another piece of this is I work with some of the doula organizations about how to engage and bring fathers in and bring down some of those barriers and have informative conversations and help and make sure that we are working as a collective, as a team. So that's one of the things too, that also making sure that whoever the birth and support person that you're engaging is a good fit, right? That he feels comfortable, he feels that he has a place at the table. And so I think that those are two things that I would strongly recommend. It's not just about having a doula or a midwife, it's about having the right one.
Yeah. Well, it's funny that you say that, because I would say some of my most reluctant fathers who weren't sure about having a doula when I was doing doula work were frequently my biggest fans at the end. They were the ones that sent me more recommendations than anybody else. It was those guys. And it was like, oh, I just didn't know, I just didn't know. And I didn't realize that you weren't there to take over, right? Like, I'm not there to take over. I'm here to make you guys amazing together.
And I want to say this too, I think understanding what it is, what the reasons why he's reluctant are, right? Is it that he doesn't understand? Is it because, like you said, Nicole, he feels that it's not safe? And then addressing specifically versus I feel, this is why it is safe. This is what the statistics show. This is what it is. And this is how we can create a safety net. We can make sure that we're clear about what hospital the doula is associated with. If there is a progressive, if a condition does present itself, right, or a situation does present itself, and if you're not comfortable with that, how can we explore, like we said, going back again, an integrated model of care if that's a compromise, right? We can have an OB and a doula work together to give us that.
I actually wanted to, I'm glad that you brought that back up, because there's still another issue with that. So we have a really great integrated model here in my community. Dr. Kapitanakis is amazing.
Good.
And he now has a midwife on staff. And then he works really closely with a lot of doulas. I mean, I was his primary doula for many, many years. And so we had this incredible working relationship. I mean, like, I had his cell phone number and I was the one, not the nurses, texting him and saying, hey, it's time to come. This baby's on its way, or like, hey, this mom really needs you here right now. And like, that was the kind of relationship that we were able to have. You know what the problem with it is? He can't afford to take Medi-Cal. He cannot afford to accept HMO. So the only people that can come to him are people who are paying PPOs, because he cannot keep his lights on in his office if he takes anything less. Like if he and Medi-Cal barely pays, even if they do, they take months to pay. Our local birth center here, our local birth center here has been here for 35 years, and it just closed down because of Medi-Cal reimbursement, because Medi-Cal is not reimbursing enough, or often enough, or frequently enough. They're taking too long, and they've had to close down their birth center because they cannot keep up with the cost of running a business in California particularly, but like this is happening everywhere.
1 second, Don. 1 second.
Yeah, you're fine.
He's got 5 minutes, so we gotta.
Yeah, I was gonna say we'll wrap up.
We'll need to wrap up, but. Oh, good.
I'm gonna grab my water.
I'm sorry, I've got people coming and going, and it's
No worries. We know you got 5 minutes. So, but anyways, so I kind of lost my train of
we
thought
were
there.
just talking about just how unfortunate it is that we have somebody that is really being exemplary, but the economics are not working out for him to
Right.
really fully show up the way that his patients need him to.
Right. And you know, I mean, the guy's booked. I mean, he can't take any more. He has to block his books every month because he can only take so many. But I mean, I mean, when I think that's a whole nother discussion that we'll have to have. But you know, when we start talking about the providers that are trying to do it right, that are trying to do low intervention, that are trying to keep the economics, they are dying out there. It is almost impossible. And it's no wonder that so many obstetricians get sucked in by this systematic issues, because surviving, you need in order to financially make this viable business for them, right? It's a business still, even for an obstetrician. They have to take 20 to 30 patients a month. Who can manage that?
Right.
No, midwives are doing home birth. They're doing maybe 7 at the most.
Sure.
Right. And so like, that's the other issue that we're having, is like the whole economic pressure of everything, the cost of everything is impacting people. And so like, you know, I never want to be like, I don't think these providers are going to work every day. And I've said this probably multiple times on the podcast already. They're not going to their job every day thinking, who can I traumatize today? Right? They're not. They think that they're doing the best. They want to be doing the best, but they also have to like manage their lives.
Yeah.
And that is a whole thing that is, I would not want to be an obstetrician in this day and age.
Yeah. I couldn't agree more, Don. I think that there is water to carry on this issue for providers, particularly, you know, OBs and people who are in service. But I think a lot of this, not enough focus is placed upon the systemic issues.
Yes.
And create climates where you're not able to function with compassion.
Right.
And if the compassion that you may want to have is at a direct, you know, it conflicts with what you have to do to keep the lights on. And unfortunately, a lot of, I think one of the most sobering examples of that, I was at a conference probably about 3 or 4 years ago, and I was doing a breakout session, and the majority of the people in the room were either current OBs or nurses, and this very, very ambitious, very, very hopeful medical student.
Yeah.
You know, she raised her hand and she talked about how she was going to practice and the level of care and compassion that she wanted to give every single patient that came through her doors. And this is why she wanted to go into this work. And it broke my heart, because I sat there and I watched these current providers that were so jaded her apart.
Yep.
Pick this poor young woman apart and literally suck all that hope and ambition out of her and tell her that her thoughts and they basically told her it was a fantasy that was not realistic.
Mm-hmm.
And that broke my heart, because we're talking about, and I don't want to, we've since, become good friends. But this is somebody that was that we are lucky to have in the profession. She was a woman of color. She was going to enter the workforce with the double Ivy League degrees. And I just watched that and I was like, oh yeah, I can't let this continue to happen. I have to address this as well. So there's a lot of work to be done. And I think that it is important. And let me talk about this. I know that we're short on time. I think it's important that not to underestimate the power of our collective dollar, right? And so it's important that we make choices about who we support with the dollars that we spend. It's also important for those of us who are inside of larger organizations or companies that we put pressure on our employers and to reshape the manner in which they shape their benefits. So for me, that's one of the ways that we approach this. So there's large corporations that I have the opportunity to kind of consult with, and I have these conversations candidly about, if you believe that this makes a difference, I need you to have a conversation with your payer about something as simple as bundling benefits, right? And having a flat cost associated, whether or not there's a cesarean or whether this birth takes 15, 20, 40 hours. So there's not incentive for these doctors to cut on people and do, pervasive measures. So there is an economic piece that we still do wield a certain amount of power over. And so with our dollars, with our things, so there's something that we're working on too that I haven't talked a lot about publicly, and that is what we call the Alliance of Corporate Maternal Health Champions. And so what this will do is this will be a framework for companies that believe that these issues should improve. This is what you believe in. This is how we want to see you support paid leave. This is how we want to see that you shape your benefits. These are the things that we want to do. This is the legislative efforts that we want to see you support. And these are the conversations that we want you to foster within your system. And so we're working on this from a lot of angles, but I think that there are ways that we can, one, it's information, right? And so oftentimes companies and insurance companies are allowed to get away with taking advantage of their consumers because we just simply don't understand. And so having these conversations, the people tuning into this podcast.
Yes.
You got to share it with somebody. You need to share it with 5, 6, 10 people so that they understand and show up informed. And empowered and understand that they are not just helpless and completely at the mercy of the system, that we have the power to change it, but we're going to have to push, and we're going to have to push hard.
That's right. That's right.
Well, Charles, thank you so much for joining us, for sharing your story, and just keep doing the work that you're doing. And as always, we ask this last question. So speaking of the village, who would you recommend to every mother, every listener to have as part of their village?
Yeah, I think you got to start right here. I think you got to stay tuned into the podcast. I think you got to stay tuned into the community. I think you got to stay tuned into these sheroes who are working tirelessly to bring you the resources, and then go from there. That I think that, if there is somebody out there that has experienced the challenges that you are facing, whether it is access to care, whether it is feeling heard, feeling understood. The wonderful thing is that these days we have the resources and the connectivity because of tools like social media and YouTube and podcasts to be connected in a way that we weren't once. If you are somebody that is dealing with trauma or grief or loss, I strongly encourage you to find community. I am a strong believer that solitude is the enemy in any situation. Going into any drastic decision without the informed opinion or support of people is not advisable. So please seek community wherever you can find it. And I think that when we talk about immediate resources, tap in, please do consider the investment to make doula care a reality for you. And then in doula care, it can even be in the postpartum phase. It can be throughout whatever aspect or however. There's people that
be virtual. Virtual.
Yeah,
Affordable. That's far more affordable.
yeah, and so all these things are things that I would just really seek people. I would really encourage people to just seek community and understanding, and understand that that the thing about it is this. So this is what I really want to leave people with, is that although some of the things that we talk about in the conversations had here, and maybe the people you heard of and you hear these stories of people like my wife or some of the other families, they're dark and they could be triggering. What I want you to understand is that we can fix this. Is that we approach this every day with the fixes, where I would not be doing this. I would not be committed to this if I did not believe that we could fix this.
That's right.
Period, point blank. And I'm of the belief that we should have a goal as a country of 0 preventable deaths from pregnancy and pregnancy-related causes by 2030.
Yep.
If it's good enough for world hunger, if it's good enough for global warming, if it's good enough for all these causes, it should be good enough for mothers and families. And so, but it's going to take hard work, and it's going to take prioritization. And I think the last thing that I'll say is, as we approach this election, every election, this issue around supporting, improving maternal health and infant health is something that's uniquely bipartisan. So the person that you vote for, be sure to ask them directly or find out what they plan to do. I don't care if they're running for dog catcher, like whatever it is they're running for. They're running for president, they're running for whatever. They should have a plan to improve maternal health outcomes, and it should be a priority for them. So
well, and helping people understand that at the state level is critically important for your healthcare options, and so many people only vote on the president and not their local community stuff, and their state has far more impact than any federal legislation at this point.
No question.
So anyways, Charles,
thank you.
Love you. Thank you so much.
Part 2, thank you for the work that you're doing. Thank you everybody for listening, and please stay tapped in. All right.
Thanks, Charles. Appreciate you.
All right. Take care.